As families prepare to gather for the holidays, adults over the age of 65 face a higher risk of severe infection from respiratory illnesses like COVID-19. So, how do we protect ourselves and our older family members during the highest risk months of the year? Here with critical information is respiratory specialist Dr. Juanita Mora. Thank you so much for joining us today. Why do you think older populations are more at risk for severe COVID-19 infections?
Well, Megan, what we know from over the last 5 years is that people greater than 65 years of age have a weakened immune system because as we age, our immune system naturally weakens. Number two, we also know from COVID-19 data, et cetera, that they're going to be higher risk for basically chronic medical conditions that put them at higher risk for COVID-19 complications, such as diabetes, high blood pressure, cardiovascular disease, asthma, COPD, emphysema. And the last thing, just looking at data, September 2024 to October 2025, we have had 44,000 deaths in the U.S. from COVID, and 2/3 have been in people ages 65 and older, which is the reason why it's so important that we continue vaccinating everyone.
What steps should families think about, kind of taking before all of these holiday gatherings?
So here are my top tips, Megan, when it comes to holiday gatherings. Number one, vaccination. Everyone 6 months and over should get a COVID-19 vaccine. Number two, good ventilation in the holiday room. So put those HEPA air filters on to get good ventilation, less propagation of the virus. Number three, if someone is sick, mask around, especially the most vulnerable, the newborn babies, people greater than 65. And then continue testing. If someone has cold symptoms, get a COVID-19 test at your local pharmacy. Get tested so that you don't propagate this virus within your family.
And where, too, should we send our audience if they're looking for guidance on vaccinations for the COVID-19 virus?
So, number one source, I would tell patients their primary care doctor. That's a trusted messenger. Number two, any trusted website, such as the Champions for Vaccine Education, Equity, and Progress, cveep.org. or their local Department of Public Health as well that has all that good information on vaccines and the CDC.
All right, talk to me about long COVID and kind of the impacts it has, especially maybe on the older population.
Sure, we know that long COVID is basically a result, and multiple COVID-19 infections put people at higher risk for long COVID disease and symptoms. What we know is that COVID-19 is a very inflammatory virus. So as it goes and travels to different organs, it can put people at higher risk for different symptoms. So as it goes to the heart, it can cause people, put them at risk for arrhythmias, heart attacks. As it goes into the lungs for new onset asthma, COPD, or emphysema. As it goes into the brain, it puts them at higher risk for stroke. And now we know there's a correlation between development of Alzheimer's disease and long COVID, which is more of a reason to get vaccinated and be less of a risk of getting infected.
Great information, something we definitely don't want to happen. So where can we go to get more information?
Sure, people can, if they're interested in the COVID-19 vaccination, can go to their local doctor, which is usually where they can get it, or their local pharmacist. And they are well covered under private insurance, Medicaid, Medicare as well too. And again, they can read more on cveep.org.
Thank you so much, Dr. Moore. Appreciate it.
You're welcome. Have a beautiful day.